There are roughly 2.3 million people behind bars in the United States, one of the highest rates in the world. Next week on April 29th at 9 p.m., Frontline explores what it calls this country's addiction to incarceration in the special prison state. Here's a preview.
My mama was locked up, my daddy, my brothers, my cousins, everybody.
I've been in this jail probably 30, 40 times.
The system set up for them to fail. When they come out of prison, there's nothing for them.
The definition of insanity is doing the same thing over and over again and expecting the results to be different.
We need to distinguish between who we're mad at and who we're afraid of.
In conjunction with the Frontline episode, NMIF producer Megan Kamerick sat down with experts and advocates to explore the ongoing problems at Bernalillo County's Metropolitan Detention Center. Costs have soared in the last 10 years with chronic overcrowding and more than half the population suffering with a mental health issue. The MDC is now the largest mental health provider in the state, according to the former head of the facility who stepped down earlier this month. The county is looking at a number of options to curtail recidivism and stop the cycle of incarceration.
I want to thank you all for joining us today on New Mexico in Focus. I'm here with Lisa Simpson. She works for Bernalillo County overseeing jail population reduction strategies. And Paul Guerin is a researcher with UNM's Institute for Social Research. And Artie Pepin is the chair of the Bernalillo County Criminal Justice Review Commission. Thank you all for coming to talk with us. Lisa, I'd like to start with you. The head of the Metropolitan Detention Center, Ramon Rustin, he resigned earlier this month.
Yes.
And he said the two biggest issues at the jail were overcrowding and behavioral health issues. How are these two problems related to each other?
Well, a very high percentage of the people in the Metropolitan Detention Center are struggling with mental illness. The psych services caseload is about 950 people. That's over half the jail. And the mental illness tends to be higher among the female population than among the male. And it also depends on how you measure it. There's Bureau of Justice statistics information that suggests that jail populations generally run about 65 to 75% of mentally ill individuals.
That's astounding.
It is, and it most people would say dates back to the 1980s when there was a push to deinstitutionalize the mental health facilities, which was not a bad thing, but the services in the communities didn't get funded to accommodate those individuals in community-based services. And so what has happened over time is that those people have, to a great extent, decompensated and ended up in our jails. For the police, often that's the only alternative if they are concerned about the safety of the individual.
And tell me just briefly about the idea of a triage center for people in crisis.
What a number of communities have done is develop crisis triage units. We have here the psychiatric emergency services that's run by UNM, but there's a very, very high standard for who they can take into the community, into the facility. It's essentially people that are acutely suicidal or homicidal. There are many people that the police encounter that don't fit that criteria, but they are having a psychotic episode, they are struggling and could decompensate further. And so for those individuals, the police right now don't really have an option of where to take them other than the jail. And typically it's on a low-level charge, such as trespass, perhaps urinating in public drunkenness. And right now, those are people that are going to jail that the police would feel comfortable taking to a place where they could receive services. So we're just beginning the process of bringing the people to the table to plan a crisis triage center. It typically involves beds overseen by a provider, a doctor, but staffed primarily by psych nurses, social workers. The person can go for stabilization and then be connected to services after a period of stabilization, typically 3 to 5 days.
So that's an alternative to just putting them in jail?
That's correct.
Okay. Paul, let me turn to you because your institute tracks a lot of data about the Metropolitan Detention Center. Our jail is above average in terms of overcrowding compared to other cities, I read in one of your reports. So in addition to the mental health issues, what are the other factors driving overcrowding at MDC?
Well, there's a variety of different factors. So what creates jail population is really two things. It's how many people come in, it's how long they stay.
Okay.
So those are the two factors that create the population. And in our case, in Bernalillo County's case, and it's a national trend, populations are actually going down. So bookings are going down nationally, so it's not how many people are coming in. Jail populations are trending downward in the country, even among large jails. Our jail just happens to be a little bit different. Our jail actually has been crowded for a long period of time. And our crowding is primarily caused by how long people stay in jail, not how many people come in jail.
Why are they staying so much longer?
Well, that's a good question. That's one of the questions that we've been looking at for a number of years. And again, I think we understand what causes some of the crowding in our jail. So it has to do with certain types of the population or portions of the populations. And
who are the people in jail? I was looking at your report and it's like the top offense was DWI, which I thought was pretty interesting.
So even if you look at national data, the largest number of bookings, people coming into jail, the flow is actually drug abuse violations, and then it tends to be less serious crimes. Aggravated assault is probably the 7th largest contributor to bookings nationally. So we follow that trend. We're not unusual in that trend. So ours tends to be DWI, domestic violence type cases, so minor battery cases and fraud, things like that. So our population is primarily comprised of people who are not violent. So a lot of public order, a lot of property type crimes, drug abuse violations.
What does it mean in terms of cost for Bernalillo County, having this continual overcrowding and people staying longer?
Well, in our case, we know that costs, in Bernalillo County's case, we know that costs have increased over time. So I think, again, in one of the reports you looked at, I think we show some costs from 2008 through 2013, and those costs have increased, and they continue to increase. And there's a couple of reasons for that. First of all, there is the issue of crowding. There is the need to send people out of county. So that cost is immediate. That's above and beyond the cost that is normally needed to operate the facility. And then behavioral health costs and medical costs. So the contract with the private provider actually comprises a large minority of the total budget.
Wow. Okay. I turn to Artie because you're going to solve all this. You're chairman of the Bernalillo County Justice Review Commission. First, give us an idea of what that group is. What is its mission?
The group was created by House Bill 608, passed in the 2013 legislative session. And it includes all the major players in the criminal justice system in the county. The chief judges of the 2 courts, the Metropolitan Court and the District Court, the district attorney, public defender, the director of adult probation and parole, the sheriff for the county, and the chief of police for APD. It also includes the director of the Association of Counties, as well as the chair of the Bernalillo County Commission. So all the folks that are involved in criminal justice are involved through this bill in the commission. And the commission is charged to examine the criminal justice process in the county and find ways to improve it. And we're directed to look at things such as community corrections alternatives to the jail population, directs us to examine overcrowding, and also the way cases flow through the criminal justice system to see if those things can't be improved.
Well, I was struck by his description of who is in the detention center. In this upcoming Frontline documentary, Prison State, the head of corrections for the city of Louisville said, "We're locking up people that we're angry at. We ought to be using this space for people that we're afraid of, people that are going to hurt us." And I'm wondering if that description is relevant here in terms of overcrowding at MDC.
Interestingly, one of the things that the law directs the commission to look at is should local or state laws be changed in some way. And we haven't really gotten to that part yet because we've been looking mostly at process. We do know that we have an unusual length of stay pre-trial. That is, before someone gets to trial or they plead guilty or in court, they stay a long time on average, a higher than average time.
Why is that?
It could be from a number of causes. I think that one of the important steps that's already been taken through the work that Lisa's done is the county has funded more robust pretrial services. When judges are determining what conditions will allow someone to get out of jail before they go to trial, before this they had limited options. You set a bond, so you tell someone, well, if you post $1,000, you can get out, and then you have to come back to court, next week or in 2 weeks. Well, many people wouldn't have the money or they couldn't come up with the funds, and they would stay in jail until their case came up.
They couldn't afford a bond.
Correct. Okay. But with the expansion of pretrial services, I think that the courts have been more willing to allow people to be released with non-financial conditions because they're reporting to pretrial services, they're keeping in touch, and really the only two restrictions, the only two considerations the court gives when they determine what conditions will allow you to be released are you a danger, a threat to people, and will you come to court when you're supposed to? Mm-hmm. And if you can satisfy those two things through the pretrial services, there really is no reason to tell you, and you should put up $1,000 or $500. That for a lot of the population that ends up in the jail, that's a significant amount of money, and it can prevent them from being free when they're presumed innocent before they're adjudicated.
A consultant earlier this year with the Institute for Law and Policy Planning in Berkeley released kind of a scathing report. He said law enforcement brings too many people to jail on minor charges. Too many who hold no risk are held in pretrial detention. And for far too long, too many filings result in dismissal, and so many are released without conviction after serving long pretrial incarceration. He said the system has one of the worst records of delay in the nation, and that's a primary cause of jail overcrowding. So what kinds of fixes are you all looking at?
We are examining the pretrial detention issue through the use of pretrial services and other means. Many people are also held in the jail, as Paul knows, because they commit probation violations and they wait a long time before the court can schedule them to review their conditions and then re-release them for violating a relatively minor condition of probation even after they've been adjudicated. I wouldn't criticize the police department. They have a difficult job and they need to arrest the people that's appropriate for them to arrest. But I do think, and I think the Commission is finding, that there are ways the system works more slowly than it should, and it's a complicated system because it involves so many players. We want to be careful in the changes that we make and propose because you don't want to have unintended consequences that make the system worse, but I'm confident we can make the system work more efficiently. We have a more efficient system in other counties in the state and other places in the country. We do have extraordinary delays we have had in the jail, and I think we've taken some steps and we will take more steps to address that.
Lisa, I want to turn back to you because you have varied experience. You're an attorney. You helped found Crossroads for Women, which helps women coming out of incarceration, I think, facing addiction and mental health issues. You've worked in other cities or consulted in other cities. So give us an idea of the pretrial services that Artie was talking about. What are the things that you're working on to make this, to get more people out of jail who might not have to be there?
Well, pretrial services is a program that many jurisdictions have found to be very effective in managing jail population. It works in a couple of different ways. One is most pretrial services programs utilize an objective risk assessment instrument. And so that's an instrument that's been validated either here or in other jurisdictions that look at the individual defendant and typically their criminal history, typically their stability within the community, and scores them on a risk assessment instrument that gives the judge a statistical understanding of what risk this person poses. It doesn't supplant the judge's decision, but it's another piece of information that based on these factors, statistically, this person is 98% likely to return to court, or 98% likely not to be rearrested.
And this is something we don't have in place, but you're working to put
Well, we do now have it in place. It took some time, and the head of the pretrial services program had been working on it as well. We just sort of kept it moving, kept that process moving, and it now is being administered prior to felony arraignments. Typically, best practice would be that it's reported at the very first appearance of the defendant, which is not yet happening here, but it is something that we are also trying to move towards. And what most jurisdictions find is when they start using an objective risk assessment tool, people generally are lower risk than they were thought to be. And so it provides sort of some additional information that the judge can rely upon in knowing exactly what risk the individual does pose. And
I want to ask both you and Paul, since the shooting of James Boyd by the Albuquerque police. We've learned he cycled between incarceration and mental health hospitals, and in between he was often homeless. So when we talk about these issues at the Metropolitan Detention Center, how common is that scenario? What is that sort of extra factor contributing to the long-term incarceration issues?
Well,
or the overcrowding issue?
It's huge. Our data doesn't actually pick up who in the jail is homeless, but anecdotally we know that it's a large segment of the population, particularly of the mentally ill. And we are also working to address that. One of my charges is, in looking at jail population reduction strategies, is developing alternatives to incarceration. And one of the things we are working on is developing supportive housing beds in the community. We're working with the city to do a joint project that would develop 150 additional beds that would serve the population that is in the criminal justice system.
And supportive housing it's housing and then it's got wraparound kinds of services?
Exactly.
Okay.
Exactly. So that would include case management, counseling, vocational support, family support, access to benefits where they're qualified. And so, yes, it's wraparound services. Typically people that have had their mental illness or their addiction sort of decompensate to the point where they end up in the criminal justice system have a really broad range of serious needs, and it can't be solved with a Band-Aid. It does require those wraparound services and typically housing. It's very difficult for individuals to break out of that cycle if they're not in stable housing.
Paul, you mentioned that a lot of people going in for small drug offenses, and the U.S. Sentencing Commission has moved recently to lessen the federal sentencing guidelines for a large portion of these kinds of drug offenses. Does that impact the MDC, or is that only for felony or federal charges?
Well,
do we know yet?
Well, I think the U.S. Sentencing Commission is more concerned with what's going on in our prisons, and typically most of the research is around prisons, I think, rather than jails, but there are impacts on the jail. So similar as you know, the jails are often holding lots of people that we're not really scared of, but that make us angry. And I think that one of the goals has to be is better understanding who those people are and why they get there and how frequently they come to the jail, and then how to deal with them. So we do know through other research that housing people is an important factor in stability, and housing them tends to reduce their costs and their contacts with other portions of the system, including hospitals, emergency rooms, and jails, all sorts of services. So we know that thinking about those things and understanding better the populations that comprise the jail and what's holding them there can actually stop people from cycling back in and reduce their length of stay. And I think those are a couple of the important goals for the commission as well as the county to better understand and grasp hold of and determine what programs will help them do that. You know, people who come in frequently, how to reduce their contacts. And then people who do come and they stay for relatively long periods of time on relatively minor charges, to reduce those length of stay. So people who come into the jail for charges such as murder or what we might consider serious crimes that we're afraid of those people, it's appropriate for those people to be in jail, and it's appropriate that their cases take a longer time to dispose. But overall, as already noted in our system, in our county, cases take an inordinate amount of time to resolve in terms of whether they're less serious or more serious.
So Art, as we're coming to the end of our discussion, but with the DOJ report about the Albuquerque Police Department and the other issues going on around that, do you see an impetus and more of a political will to really put some policies in place that might have an impact on these things?
Yes, I think I can say with confidence, having worked with the folks through the commission, that everybody involved in the commission has a serious desire to make the system work better. We've tried different things at different times. We have a mental health court at the Bernalillo County Metropolitan Court. We have drug courts in both places, a DWI drug court at the Metro Court. Those are diversion programs, keep people out of jail, hundreds of people. But we know, the data shows, that people are in there too long for reasons that really we wouldn't intentionally keep them in there that long. And we need to look very carefully at the process. But I believe, I've been told and I believe, that the district attorney, the public defender, the police agencies, and I'm sure the courts are dedicated to this process. We've made some changes already, and I have to tell you that not all those changes make everybody comfortable, because when you change the way you do things, you know, ultimately the judge is sitting on the bench making a decision that is going to allow someone to be out on the street, and if that decision turns out to have been a wrong one, you know where the blame will lie. So it takes a lot of courage in many instances for the folks involved in the criminal justice system to change the way they operate, because they're taking a risk, but they're all dedicated to doing it. They've made some changes, and I think they have the courage and the persistence to make more changes that will improve things in the system. You know, we were given 2 years under this act to act. And
2 years for the commission to...
Yes, for the commission.
And what's the end result? Come up with policy suggestions or implement?
We're directed to tell them in writing what laws to change, what things to do. And of course there are resource challenges throughout the system, and that's probably one of the things you suggest, you know, but it's unlikely we're going to get 100 more lawyers involved in the district attorney's office and the public defender's office, or 8 more judges or something like that. So realistically, we have to deal with the resources that are available. But there are things we can do, and there are things we can suggest the legislature support that will help Bernalillo County system work better. And many of those things will be accomplished before we report back to the legislature at the end of the 2-year period.
Okay, great. Well, I want to thank you all for coming and talking about this.
Thank you.
Thank you.
You're welcome.